Hello, welcome, beloved, beautiful souls. My name is Jem, and I've lost the LOGI camera and just using my inbuilt camera on my laptop. Now, I've just uploaded a picture of what's happening. I had skin scraped yesterday off my ankle because it's a cancerous spot. Let me talk about cancer because it is a word that we're scared of, but we don't have to be scared. I want to first share my experience. The first time ever I had a cancer was on my nose, and I kept scratching it because I thought it was just a sore, and it kept bleeding. So this happened when I was 37, and he said it was a BCC. Since then, I've had, not including the present condition of the ankle, on my face and the ankle 5 years ago, I've had 5 different types of skin cancer. Now, how do you get skin cancer? Usually from not protecting yourself properly in the sun. My generation grew up, we did know about how the sun burns, but my mother would put on zinc cream all over my face, and she would stay, because she just tanned. I, being a redhead, would go like a lobster within 4 hours, and she never renewed the sunscreen. There was one time at 16, my face was so badly burnt, I had blisters, big blisters on my face, and I couldn't open my eyes. That's how severely burnt I was. Now I want to talk about my friend. May she rest in peace, my beloved Carolyn. I was friends with Carolyn for 12 years. Unfortunately and tragically, she died on my birthday, the 10th of January. She died, though, in 2010. And what happened is that, go back about 6 months prior, we went to Bribie Island, and we were so lost in the moment. We didn't apply any sunscreen. And we're sitting in the waters because it's so blue, it's so beautiful at Bribie Island. And we're like lying back like this. And we both got severely burnt. She got really burnt. I was pretty bad, but she was worse. And within about 2 weeks, she noticed a mark, or like a brown mark, on her thigh. She went to the doctor. He said it's a melanoma. So he cut it out. But obviously, he didn't cut enough out. Anyway, a few months go past, and Carolyn started to experience all these strange symptoms. She kept going to the hospital. They kept saying, no, you've got reflux, you've got GORD, you've got this, you've got that. And she was telling me, and at the back of my head, because I'm a psychic and a medium, and I know my friend pretty well, I think, no, it's cancer. She's got cancer. So I said to her, Carolyn, go back again and make sure that they do x-rays, CT scans, whatever it takes until you get a proper diagnosis. Well, she did, and it was melanoma and cancer, but it had been too late. It was everywhere. It was in her liver, in her kidneys, in every organ, in her brain. So we went to the oncologist, which is the cancer specialist, and they said, for melanoma cancer, we can't do anything. Any other type of cancer, you can have radiation, you can have chemotherapy. We could do this for you, but it's not going to do anything for your type of cancer, which was caused by the melanoma. It was everywhere. As soon as she got that diagnosis, within a couple of months, she was back in hospital. She was sent to palliative care. 3 months later, she died. Like I said, she died on my birthday. So, even though you might be getting old, and we all have skin, it's called skin keratosis. That's one step before skin cancer. So if you have a strange spot, don't look, even if you don't know, because you don't have eyes in the back of your head. You could have a cancer growing on your back. I was shocked to know I had a cancer on my ankle. I said, how did I get a cancer on my ankle? Because all the rest of the cancers have been from my face. So I've had 4 lots of cancers, and they were all different. The first one I told you was a BCC, which is a basal cell carcinoma. The one 5 years ago on my ankle was called a Bowman's cancer. And then the last one I had removed was again on my face. I think it was my cheek, and it was a different type of cancer again. But like I was saying, you haven't got eyes in the back of your head. You can't see your back. And if you live alone, you could have a cancer growing without you knowing. Early detection saves lives. But even before we get to detection, remember that if you're going to be out in the sun longer than 15 minutes, because we all need 15 minutes of sunshine for the vitamin D, that's the way we get vitamin D, is through sunshine, is please cover yourself up. Wear a hat, wear sunscreen, and change it. It's gone within a couple of hours. Reapply it. Make sure that the sunscreen, I think you can get 50 plus now, but at least 30 plus. Wear a hat, even sunglasses. My husband, who passed away, had in his eye, and it was called something like trichor. I'm not a doctor, so I don't remember, but it was a sunspot. So sun can get anywhere. If it can get on my ankles, and the reason it gets on my ankle is if I'm walking in, say, shorts or a short dress or a skirt and I'm just thongs, the sun can hit any part of your body. So you can get cancer, a skin cancer, anywhere on your body. And Australia is known to be the hottest country. We get the most sun. These are facts. I'm not making this stuff up. And we have the highest rate of skin cancer. So please, do me a favor, once a year, go to your GP. If your GP or doctor can't do it, make an appointment with a skin specialist. Now, I hear you and say they may cost money. I know of one at Landsborough, a doctor who will do a skin check for free if you've got Medicare card. If it has to be removed, then she will charge. So please take this as a warning. It's not normal content I do, but cancer is a killer, even skin cancer. And I thought it was a very important video to make and share. Thank you for watching, and I'll let you know what's going to happen to me. The results, the biopsy, takes about a week to come back. And because I suffer from edema, if it is a cancer and he has to cut it out, I will have 2 wounds because he'll have to take a skin graft from my thigh. And I won't be able to get it wet for 2 weeks, he told me. All right, please do me a favor. Health is important. Let's even forget about cancer for the moment. Any signs or symptoms that don't go away after a week or are intense, like suddenly you get chest pain, there's certain areas, or you hit your head, you see a doctor immediately. But I'm talking about other symptoms like a cough or diarrhea and vomiting you've still got it after a week. Please see a doctor. That's what they're there for. If more people saw doctors, and we're not wasting their time, they are medically trained to treat us, whether it's cancer or disease. Please learn from me and cover up. As I said, growing up, we didn't learn. It didn't come out till the 1980s in Australia, and the slogan was slip, slop, slap. Slip on some sunscreen, slop on a hat. I forget how it went, but it was something like that. It was about covering up. And also, lastly, before I go, when I had all these skin cancers at different times, I thought it was damage I had done as a child. The doctor said, no, this is damage you've done as an adult. And you don't think anything of it. You could be driving your car, sticking your arm at the window. That arm is getting the sun directly on it. You're at risk of skin cancer. Thank you for watching. This is a lesson to all of you. Don't ignore any strange marks, spots, or any moles. If something doesn't feel right, trust your gut. It isn't right. Take care of yourselves and each other. Love, light, and blessings. Bye.